In this study on cardiovascular risk factors, we wanted to assess whether these risk factors, such as smoking, hypertension, have an impact on MS patients in below age 50, because we already know that patients with an age more than 50 years old, older than 50, are bound to have a direct impact of these risk factors on their brain through the presence of cerebral small vessel related disease, which is very difficult to differentiate from MS from an MRI point of view. So we studied younger patients with pretty basic MRI techniques, which were an assessment of brain atrophy, gray matter atrophy, and white matter atrophy, together with lesion volume. And we found that the presence of more than one risk factors, even at pretty low levels, such as a history of hypertension, irrespective of its duration, and having smoked 5 pack years, were associated when present together with atrophy of the brain. And at the same time, the presence of more severe risk factors, which were, for instance, having smoked 10 pack years or having diabetes, was associated with both a gray matter, white matter, and total brain atrophy, and an increased lesion volume. Well, this study has an important impact on the clinical approach to patients, because even in younger patients, the MS clinician should pay attention to the presence of cardiovascular risk factors and discourage, for example, smoking, and also encourage a healthy lifestyle and the control of blood pressure and regular exercise and maintaining a healthy diet.